What I want to talk to you about now is the difference between a Medicare Advantage plan and a Medicare supplement, especially folks who are turning 65. All right, you guys are going to have to make some decisions coming up. You can either go one of two ways. If you go with a Medicare supplement, that is the old traditional type of health insurance with Medicare. Medicare is the primary, the supplement is the secondary. It's very good coverage. That's the coverage I have for myself. I'm on Medicare. I have Plan G under a Medicare supplement plan. The reason I did that is I want the freedom. I want the freedom to choose the doctors and hospitals anywhere in the United States. Now, a Medicare Advantage or Medicare Part C, as some people will call it, especially people who are turning 65, you're going to get a lot of phone calls from agents. And the agents are going to say, I can get you free health insurance or very low cost health insurance. And you know what? It is. It's true. They can do it. But we need to talk a little bit about what really goes on within these plans. Okay? And one of the things I want you to consider is, especially you guys who are turning 65, you've worked all your life. You might have been on an HMO, because that's what a Medicare Advantage is an HMO. And they might have worked out well for you. But remember when you're 30, 40, 50 years old, you're pretty healthy. You know, you don't really have any major health problems. You know, some of us, you might have a gallbladder once in a while like that, or nothing, but nothing really major. People age 65 and above, we're going into the time of our life now is when we're going to start having health problems. It's going to happen. There's no way around it. We're going to get sick. And some of us are going to have fairly long, extended periods of an illness. That's when you're going to really test your Medicare Advantage plan. Okay? Because the reason is that now you have to use their doctors and hospitals. So I want you to think about this, all right? Are you going to buy your health insurance based on the cost or the quality? The United States has, some of the best health care in the world. They come from everywhere all over the world to get our health care. But if you're in a Medicare Advantage plan, you might not be able to get that. Okay? And I'll go into that a little bit more. Unfortunately, there's going to be folks who have to go that route. If you don't have a lot of income, if you're just living on Social Security and maybe a really small savings, yeah, I'm sorry to say, but you'll probably have to go that way. But don't be like, people I've met. From where I live, about 10 miles away from here, there's a retirement community. And you're fairly well off. I mean, a starting price for a home just to get into it is $250,000, $300,000, and it's only for retirees. And it aggravates me. It really drives me crazy when I talk to people from that area. And I've had guys tell me, I'm going Medicare Advantage because I can save more money, and then I can go golfing more. I'll have more money to go golfing. For God's sakes, you're gonna, at some point, it's gonna happen. We're gonna get sick, and you're gonna choose your doctor because now. Let me go over a little bit more in detail what really happens here. When you go with Medicare Advantage, you're basically out of Medicare. Medicare says, no, you're in Medicare, but you're really not. What you're doing is you're giving up all the benefits of original Medicare, and you're taking that and you're placing your health care in the insurance company, like United Healthcare. They're one of the biggest Medicare Advantage companies in the country. United Healthcare, big profits, huge incomes they make. And that's one of the things that bothers me. I don't want to put my health care in the hands of a corporation that is for profit. Because for profit, it means the less they spend on me, the more they make. Okay? So, let's say you go with, one of the big Medicare Advantage plans. And what happens first off is you have co-payments and you have a out-of-pocket, an annual out-of-pocket. It's a maximum. The government put a limit on what the out-of-pocket is. It started at around $2,500, then it went to $3,500. Right now, it's around $6,700 is the maximum that the insurance company can hit you, for out-of-pocket expenses. Now, what I mean by that, you go in the hospital, you're going to have co-payments. For the first 5 days, you're going to have anywhere from $200 to $300 for every day you're in the hospital. After that, everything else is 20% until you hit your out-of-pocket, your max. Let me give you an example. Let's say, God forbid, you develop cancer, and it's really common nowadays, and your doctor prescribes chemotherapy. Okay, first off, he has to submit a plan to the company, the insurance company. The insurance company can rule on the plan if they like it or not. They might not want to use the drugs that the doctor wants to use. They might want to use a cheaper drug. Maybe they want to use a more expensive drug, but it's kind of hard to believe. When they do that, and the chemotherapy starts, you pay 20% of chemotherapy. Now, chemotherapy is expensive. I'm going to give you an idea. I mean, you can have $100,000 easily on chemotherapy. If you go in, say, in June, and you start chemotherapy, you could have a $1,000 bill every month. And, for the first 6 months, you're going to spend, $6,000, $7,000. 67 is the max. But get this. Come January 1, you're done celebrating, Christmas is, New Year's is over with, if you're feeling pretty good, but you still have chemotherapy, you're in a new out-of-pocket period, $6,700 again. So if you have a year's worth of chemotherapy, you could have $13,000 out of pocket. It's not a real good deal to me. Okay, now, as far as the network you're in, you have to go to their doctors and hospitals. You have to. You don't have to. You can, go to any doctor you want, but you're going to pay the bill if the doctor's not in their network. And as an example, that cancer again. If you're in the South, you're going to go to Anderson Cancer Clinic. It's in Texas. It's world renowned. In the Midwest here, a lot of folks will go up to Mayo's. I've had a lot of clients go up to Mayo's through the years. New York would be Sloan Clinic. These are big, well-respected cancer clinics in the United States. I'll give you an idea, a story that happened to us, and this is a personal story. My brother developed brain cancer several years ago, and his doctor recommended an oncologist, and he went to the oncologist, and he said, I just had a funny feeling. And so he looked up some information on the oncologist. The oncologist had no experience in his type of brain cancer. He had zero experience. So he did some more digging. And my brother lives about 70 miles away from University of Wisconsin-Madison Medical School. And he actually found a cancer doctor at that university, and he got into him. And he credited the doctor with extending his life for a couple more years. He wouldn't have had that. If he was in a Medicare Advantage plan, he'd have been stuck because his chemotherapy was hugely expensive. It was terrible. So that's something I want you to consider. Now, there's a few other things about these things that kind of bothers me. Your plan can change. It's not a Medicare supplement plan like I have, Plan G. It's a contract between me and the insurance company. The insurance company cannot change it at all. The only time that plan can change is if Medicare changes something. That plan has to change with it. But a Medicare Advantage plan, they can change it whenever they want. And so you don't have any control. It's not going to happen, but they can actually cancel it. The insurance company can cancel your insurance on you. And it's not that big of a deal. There's things you can that protects you with it, but that can happen. I think the biggest thing is they can take your doctor out of network anytime they want, or they can add a doctor. But one of the big insurers about a year ago, throughout the whole United States, got rid of thousands and thousands of doctors because they had cost cutting. They had to save money. And if that's your primary doctor and your doctor's out, tough luck. You got to go find another doctor that will take you. Okay, so that's another thing I don't like about it. So you have some decisions to make. Yes, if money's really tight and you just can't afford much, you're going to have to go that route. But you know what? Think about it. You have the ability to get the best health care in the world. And please do not select your health care for what it costs you. And that's what Medicare Advantage is because you can get them free with no cost, premium cost. Yeah, the out of pocket, but you can get no premium. And do you really want to do that? Is save on premium and thinking that you're going to save some money, but there's one other thing I didn't touch on, and this is, I think, very, very important. If you're alone, if your spouse has died or just you're alone, and you have to have some procedures done, you have to get referrals, and the insurance company can give you a hard time on the referrals. On my website, if you go to my website, you're going to see some links to some videos that some of the news networks have done on these, and some of them are pretty sad. You don't always get the care you need right away. You got to wait. I've heard stories of with hip problems, you got to wait a week before they come down and make their decision is if you can get it or not. So, think about this. If you got questions, give me a call. I'll talk to you about it. But I hope this is giving you some foresight of where you want to go with this. Have a good day. Bye-bye.